I'm going to be treating a 75-year-old female today. She is a lady that presented with progressive shortness of breath, episodes of heart failure. She was assessed for open heart surgery and mitral valve repair. She has primary MR, but she's got a lot of comorbidities, felt to be a little frail, high risk for surgery. So she was referred to our team to do transcatheter mitral valve repair. So MitraClip is a procedure that Jyoti and I do together.
So I think we've been doing MitraClip since around 2015-16.
It requires some TE imaging of the valve. While he's doing that, I am working the catheters from the groin to try to repair the valve.
So what we see in this patient is this jet of severe eccentric mitral regurgitation. And as we go through the images, you can see that there is a large area of flow convergence with a really broad jet. And what you appreciate on this 3D images, we are looking from the atrial side onto the ventricle with and without color. And we see that what she has is a very extensively abnormal anterior leaflet of the mitral valve that's severely prolapsing. So there is a really broad area of the anterior leaflet that's abnormal. And what you appreciate on the bottom images with color is that this malapposition of the leaflet is causing eccentric jet of leak that's going from anterior to posterior. We want to pay special attention to the posterior leaflet, which in this patient appears to be smaller than what we usually see, to make sure that it is a safe procedure. And I think, as we had discussed in the valve meeting, and today the plan is hopefully to go with 2 devices to be able to handle the pathology that we are seeing and take care of the leak that we have.
And so simultaneously, as catheters go up inside the heart, he's showing me the mitral valve, and we are trying to repair that together by placing the clips where the valve is actually leaking. And to reapproximate the leaflet edges, which have been pulled apart, we're trying to bring those back together and stop the valve from leaking. Transcatheter mitral valve repair, it's a very safe procedure. It can be used in patients with either primary MR or secondary MR. We do 4 patients a day on average. We've treated patients anywhere from young, sort of high-risk patients all the way up to 95 years of age. And they go home next day, and to see the impact on them, it's really amazing, actually. So we've reduced her mitral regurgitation to trace. Her valve is not leaking anymore. We ended up needing to put 3 clips on. We got a very nice result. No bleeding from the groin. She's gonna go home tomorrow. So, great result for her.